We currently have over 600 clinical scenarios covering 33 different specialties. Every scenario is based on authoritative sources, journals, guidelines, and textbooks. Clinical Odyssey is a fun video game, but also an important learning tool that teaches serious medicine. Welcome to Clinical Odyssey, our medical education video game where you are a doctor seeing real-life patients. We currently have over 600 clinical scenarios covering 33 different specialties. Let me show you a scenario. Here we have a 23-year-old woman with a breast lump. She has no other symptoms. Examination shows an upper outer quadrant lump that is discrete, smooth, and rubbery. There are no other signs. Clinically, the lump appears benign, but we need to investigate and confirm. We have a list of investigations. Just like in real life, we need to decide what to order and what not to order. Imaging is essential, and we choose between ultrasound and mammography. In women of her age, the breast tissue is dense, and ultrasound is a better choice. Okay, ultrasound shows a well-circumscribed ovoid mass in the upper outer quadrant. The BI-RADS category is 4A, a low suspicion for malignancy. Overall, imaging favors a benign lump. What do we do next? We already know that mammography is less effective than ultrasound. MRI won't tell us much either. What we really need is a histological study. Core biopsy fits the bill. This shows epithelial hyperplasia and stromal proliferation. The lump is a fibroadenoma, a very common benign breast lesion. Since the lump is just 1.9 centimeters in diameter, we could watch and wait, the current standard of care. In practice, though, many patients feel uncomfortable just waiting and want the fibroadenoma removed. It is reasonable to offer surgical excision as well. Let the patient decide. Mastectomy is unnecessary and is an invitation for a malpractice lawsuit. No hormone therapy. This is not a malignancy. Right. Let's see our results. Looking at the statistics, some doctors did perfect. Many others got it mostly right. The gameplay requires us to apply our knowledge. This leads to the next part of the scenario, the expert review. Here, we have the diagnosis and reasoning part of the review. This was written by a specialist, a general surgeon in this case, and details how he'd have reasoned out the diagnosis and management in real life. Although you wouldn't disregard cancer, most breast lumps in young women are benign, and we would approach the diagnosis from this angle. We apply the triple test, and once we've diagnosed a fibroadenoma, we classify it as simple or complex and manage appropriately. The discussion section provides a general overview of the disease. Next are the take-home messages. Even if we forget everything else, here's the key items to remember and apply to our practice. Finally, the references. Every scenario is based on authoritative sources, journals, guidelines, and textbooks, with a preference for journals and guidelines, because these are easily accessible online. We want doctors to easily read more if they want to. As you can see, Clinical Odyssey is a fun video game, but also an important learning tool that teaches serious medicine.